Hi, my name is Erica, aka Stretch. I am a level 3 fascia stretch therapist, and I worked with Tats over the course of his recovery to help mobilize his scar tissue.
During my recovery period, I probably worked with you for over like the whole 6 week course, but I had to wait until after the tapes were removed and I was at the 4 week mark. Now, after the 4 week mark, you can start to use silicone gel or cream that you can put in on your scar tissue while you massage it to help mobilize it and does help soften your scars up a bit. Or you can use vitamin E cream as well. It's very different from you just rubbing the cream on. There's a special way to do it, and we're going to show you how.
Normally, with scar tissue, you want to feel around for where you have the greatest adhesion. So, as you go along the scars, you'll find areas that are a bit stiffer, or there seems to be more what you call clumping or thicker than others. So, you can start by gently doing circles or going side to side. So what you're trying to do is get a little bit of movement, try to feel the tissue to see where it needs the most amount of movement. Now, what I find with people who've had big surgeries, whether that's mastectomies, double incisions, cesareans, things like that, is towards close to the joints, or where they've made the incisions that are closer to the joints, those areas will be tightest, and they are also where it will need some work. So you can go along the entire length of the scar and just gently mobilize. In terms of the pressure, how I would start is you can palpate through. So palpating just means you're gently touching the tissue. And when you feel the skin start to let you in, so I start to apply a little bit of pressure, just minimal, and then I'll feel almost the skin and the muscle tissue start to yield and almost spread apart or sink, letting my fingers sink in deeper. So you're going to touch, let it sink, and then you can gently move the scar tissue around. So you can do some direct work on the actual scar tissue line or the actual scar line. And you can do a few repetitions that way, all the way through.
It's going to feel slightly uncomfortable, but don't be afraid of that. If you feel sharp pain, obviously don't go too hard or don't press into it, but it's going to have quite of a numb feeling around because you're going to have a loss of nerves, unfortunately. And areas like where Erica is working on right now, which is usually where the stitching ends, that's going to be quite tender. So just be a bit careful around these areas.
And again, I talk about wait till the tissue lets you in. And that comes from when you let your fingers sink into the tissue, you're waiting for your body to let you in first. And that's really important.
Now, it's usually best for you to apply a generous amount of cream on while you do this, but unfortunately, I don't have any today.
Now, the next step once you've done that is to start mobilizing the tissue around. So when you've cut through and you've removed a piece of the skin and stitched it back together, fascially and muscle tissue-wise, you've actually cut and rejoined things, and that's part of the reason why you're getting the restriction of mobility. So we want to be able to work outwards if possible. So again, you're going to feel where the scar is, let the tissue let you in, and then you can gently move away from the scar. And you should be able to see my fingers sinking, imprinting. And then if you can see, I'll see if the camera will let me show. But see how there's my finger imprints there? We're wanting for you to be able to see those things as well. So again, you're going to let the tissue let you in and then move away from the scar. And then sink and then move away from the scar. And you want to be able to do this on both sides. So same thing here, you're going to sink and then move down. Sink and move down. Now, when we want to see this as local or direct mobilization of the tissue, but we also have to understand that this will move as our limbs move. So we want to start getting the limbs involved as well. So Tats, I'm going to get you to bring your hand down. You can do this by yourself too. So what I'm going to do is as I'm stretching, I'd like you to move your arm up gently. Move it up and away. Yep, into some shoulder flexion. Perfect. And then bring it down. And then again, as we move up, we're going to move the arm up and away. Perfect. You can even go a little bit horizontal. So if we want to go horizontal from the scar, you can take your arm out a little bit more. That's it. Good. And then back. Out and back. So in terms of a self-release, you can obviously have a family member or friend do it, but it's always best to learn how to do it yourself. So I'm going to ask Tats to feel around for a scar, and you want to start with gentle pressure first, so like really small movements, gentle pressure, and then you're going to let your fingers sink down in, and when the tissue starts to let you in, you can then follow that, moving the limb and letting yourself just slide through. So you'll find with Tats, it's a little bit different now that it's a couple of months into his recovery. But initially, something I do remember is a lot of it, you'd sort of feel like bubbles.
Yep.
You would also feel some areas of the tissue that were a little bit rougher or elevated. So those, when you hit those, try not to bulldoze your way into them. You want to apply the same thing. So when you do hit those areas where it's a little bit more sore or tough, stay there, wait till the tissue yields, and just gently and smoothly work your way through. Yeah. Great.
Now, just remember, guys, only do this once your scars have completely healed up. If there's any like openings or anything like that, you don't want to do it just yet because you don't want to risk it tearing and taking more time to heal up. So usually around the 4 to 6 week mark is when you start doing this. Now, if you still want to know more, make sure to hit up Erica at Alpha Athletes. She can always take you on and show you how to do it herself.